Thank you for having me this afternoon. It looks like you guys have had a very full agenda today. Lots of information has been shared, so lots of really good information has been shared for you. I'm here actually to talk about, with my colleague, we're going to talk about navigating the patient financial journey. Probably not the most exciting thing to talk about, but at the same time, it's a reality in our healthcare system that we have to talk about what happens financially. And that impacts our patients dramatically sometimes. So we want to make sure that at the Cleveland Clinic, we're partnering with our patients so that we can get you the best care with the best organization, but do so with the least financial impact to you. So that's what we're going to kind of focus on this afternoon. And bear with me here. I'm going to see if I can get this to work for me. So these are just some of the topics that we're going to talk through: understanding your healthcare benefits, the registration process and insurance verification, what that means for you, how you're part of that process, the financial responsibility, of course, that goes along with our healthcare system. And then my colleague, Caitlin, is going to talk about the authorization process. So she'll talk through that. Probably many of you are familiar with needing authorization. So she'll give you some details on that. So just as an overview, I'd like to start out with just talking about the different types of healthcare coverage that's out there. Historically, a long time ago, there used to be very few health insurance plans. You probably got it through your employer. You got a card, you went to your provider, you had your care, and you were done. You didn't have to think about it anymore. That is not the culture that we are in now. So now you have to make choices with your healthcare coverage, and those range anywhere from HMOs, PPOs, EPOs, POS plans, reference-based payer plans, Christian ministry plans. There's just so many different types of plans out there that we have to get ourselves educated on them and what's going to work best for us, and how we can work with that plan to get the best care for ourselves. So if you're looking at plans, HMO plans, those are health maintenance organizations. Those are the plans technically that have the least flexibility in them. However, they are also typically the lowest cost in premium most of the time. Usually you need a primary care provider, and then any services you have outside of that primary care provider, you're going to need a referral from that primary care provider in order to go and see that specialist for yourself. So there's not a lot of flexibility there. The other thing that they do is they have a very narrow network typically of providers that they work with. So you are kind of set with a certain number of providers. And if you go outside of that, they don't always offer a lot of help as far as covering your services for you. You moved from there to the POS plans. Those are a little bit more flexible. We call those a medium flexible plan. Those are the ones that you still have a primary care provider, but you don't necessarily need referrals to go to specialists. You may or may not have coverage outside of their primary network with those POS plans, but of course the cost does go up from that HMO plan from a premium standpoint for you. Then we get to our EPO plans. Those are exclusive provider organizations. Those are much broader. They actually are very similar to the PPO plans. Those are provider-based organizations. Those two together are the high flexible plans. So you have the most ability to go and see who you want to see, when you want to see them, with needing the least amount of referrals and things like that from your insurance plan. So just the different plans to kind of think about. One of the things you do want to know when you're entering into working with any healthcare organization, any hospital system, you want to know what plan you have so that you know how to work with your plan and then partner with your healthcare providers in order to get that plan to work for you. All right, so some resources for you. Obviously, whoever your insurance carrier is, they are your primary source of information. They're the ones that you have actually contracted with to say, they're going to tell you what they're going to do for you based on the premium that you are paying them. So they are your primary source of information. Certainly take advantage of calling your insurance companies, going to their websites, and getting all of the information that you need about your plans. Ask a lot of questions, and you'll see that in another slide that's coming up here, to ask a lot of questions. There's also education workshops that are available. Personally, being in healthcare for as long as I have, I have to keep myself educated regularly. And it's not an easy thing to do all the time. So take advantage of those education workshops because you'll hear information that you haven't heard before, or you're just hearing it at the right time where it makes sense to you now when you need that piece of information. Here at Cleveland Clinic, we also have patient financial advocates. That's a team dedicated to being the gateway between kind of working with your insurance and working with the financial side of healthcare here at Cleveland Clinic. So we have over 200 patient financial advocates, and we work with our patients every single day, sometimes on very complex service lines, sometimes very complex treatment plans. Our role or our goal really is to partner with you so that we can get your insurance to pay for the services that you're having here at Cleveland Clinic. So take advantage of those resources. They're there to help you. You've probably seen these. You may already know what these are: copays, deductibles, co-insurances. These are the things that you need to know about your insurance because they directly impact you from a financial standpoint. So your copays are those fixed amounts that your insurance is telling you before I do anything as an insurance company. This is your part that you have to pay before you have service. So typically those are collected prior to the service happening. So you walk into a specialist office for an office visit, they're asking you probably for a copay at that point in time. Your deductible is basically how much that insurance company is telling you you are responsible for, typically on an annual basis. So most of the time, those are an annual deductible. You may meet it early in the year, or you may meet it very late in the year. It just depends on how things are working for you. But you're paying that out of pocket before your insurance is actually kicking in and taking over for you from there. Co-insurance, some folks have co-insurance, some do not. It really depends on the plan that you have. Sometimes you meet a deductible and you don't have co-insurance, so they pay at 100% after that. Other plans, you have a co-insurance, so they'll pay 80%, you pay 20%. Again, those are things that you want to know about your plan because they will impact what you're going to have out of pocket. The other thing we like to encourage all of our patients to understand is your network. So in network versus out of network. Not every provider is necessarily in network with the plan that you have selected to use. That directly impacts what your financial impact is going to be as far as what you're going to be paying for those healthcare services. So in-network providers are the ones that have agreements already with your insurance plan. So they've pre-negotiated rates. So half of the process is done for you already because they have already negotiated those rates. That's set. And now you probably have copays and deductibles, but you don't have to worry about a contract because that's been done for you between the healthcare organization and your insurance. Out-of-network providers do not have those agreements. So there is no contract. So while your insurance may offer out-of-network benefits, which means they'll pay something towards your healthcare coverage, there isn't that agreement with those pre-negotiated rates. So it is more challenging from a financial circumstance because it's going to typically cost more out of pocket. Now, one of the things that we can do here at Cleveland Clinic, and we work with our patients who are out of network, and Caitlin's going to talk more about this, but there's authorizations, there's single case agreements, there's different things that we can do as an organization to help partner again with you and your insurance to maybe negotiate some of those in-network rates for you. So we want to be able to work with you, but it's important for you to know that information ahead of time. So questions to ask your insurance, lots of questions. So we're always encouraging ask questions. And if you don't understand the answer that you're getting, ask again, maybe ask in a different way, or ask a different person sometimes. Here at Cleveland Clinic, if you do work with one of our patient financial advocates, we call it a patient benefit letter. So basically the questions that you see up on the screen right now, we put your name on there. We put what the service is that you're having here at Cleveland Clinic, what the diagnosis is that's associated with it. And then we have that list of questions so that you can take that back to your insurance company and say, here's all the things I need to know because I'm looking at treatment at Cleveland Clinic. I want to know how it's going to impact me and what I may have to do. And I know you keep hearing me say partner with you with your insurance companies. Technically, you have the contract with your insurance company. Cleveland Clinic doesn't. So when it comes to working with us as an organization, we need you as a partner in that to work with those insurance companies. Things work more smoothly, and the financial burden on you is less when we work together for that. So one of the things that you will do, and it doesn't matter whether it's with Cleveland Clinic or any healthcare organization, you're going to have to register with that organization. And it's a very simple process, but it's actually very important. This starts the whole process for you from working with your insurance company. So basically your name, address, social security number, date of birth, your insurance information. So who is your insurer? What's the ID number? Do you have a group number? All of those pieces of information, we need that. We need to get that from you. And then with Cleveland Clinic, we have an electronic process where we're going to query your insurance company and basically ask them. So this is our patient. This is the information they've provided. What can you tell us about their insurance plan so that we know how to work with you? And that'll directly impact actually our patient financial advocate team, because when they talk to you, that information that we get back from the insurance company is going to help us be able to model that conversation and really tailor it to what you have, what your insurance is, and what impact that's going to have for you. And you keep hearing me say this, the patient financial advocates, they are advocates. They want you to be able to have your care. So we do want to partner with you. We are there actually to help you walk through what your insurance is, how your benefits work. As you saw in the beginning, there's multiple plans. And even within those plans, not all HMO plans are the same. Not all PPO plans are the same. So we get into the granular detail of those plans with you and really help you walk through them. The other thing that we'll do is provide estimates. So we don't want you to be surprised about the finances that are involved in your care. We want you to know upfront what that is, how it's going to impact you, and then what options may be available to help you with that financial burden that sometimes comes with the care that we're seeking within an organization. It helps us, again, to partner with you because we do better with your insurance. We have less denials, which if we get denials, that means we're working with you again. And potentially if we can't get your insurance to pay, then we're coming back to our patients, which obviously if you have an insurance plan and they have an obligation to pay, we want to get them to pay. So we're working with you on that as well. But they can help walk you through those different steps. We also have patient financial navigators. So there's navigators and advocates. We do similar things. Our navigators take it a step further with some of the assistance programs that we have at Cleveland Clinic. And then this is how you get in touch with our patient financial advocates at Cleveland Clinic. We work very hard to make ourselves available to you. We want to talk to you. You can call into us. You can see us in person here at main campus. You can actually make a dedicated appointment. So just like you would make a phone visit with your provider, you can make a phone visit with our patient financial advocates so that you can have a conversation with them, ask all of your questions, maybe find some questions you need to ask and take back to your insurance company. And then you may come back together again and have another conversation. And for those of you that like to use the chat options, we do have a chat option as well to connect with our patient financial advocates. So I'm going to turn it over to my colleague, Caitlin. She leads our authorization team, and she's going to talk through authorizations.
Thanks, Jill. Hi, everyone. My name is Caitlin Sammons. I've been a leader supporting our prior authorization team here in both Ohio and Florida for the past 10 years. So just kind of diving a little bit deeper in how we work those authorizations and what they are. Essentially, like Jill was saying, we want to work directly with the insurance to make sure that they are going to cover and pay for any of your services. Our team is pretty large since we cover both Ohio and Florida, so we kind of have them broken up into 4 different sections. So we have our pharmacy team that works on injectables and infusion authorizations. We have our outpatient team that really supports anything that happens in an office or diagnostic testing such as MRIs, CTs, physical therapy, things like that. And then the team that I directly manage, our surgical authorization team. So that is any case that goes to the OR, so the operating room, and the patient needs some type of anesthesia. And then last but not least, we have our vendor support, and really that's just kind of our overflow staff. As you know, there are a lot of different new locations for us, which is great news because it offers more access to care. However, that means we need more support and we need it quicker. So those 4 teams really make up our support here in both Ohio and Florida. So what is an authorization? Essentially, we are working with your insurance to say this is the patient's coverage, their benefits, and we want to prove to you why you should pay for this specific service. Not every service needs an authorization. A lot of times it is diagnosis driven. However, a lot of surgeries do, as well as injectables and infusions. So kind of breaking it out here, our surgical team, that could be any authorization for an ambulatory surgery as well as an elective inpatient. So a case that is scheduled. If there is a case where the patient admits through the ER, that does not typically require an authorization. It's just a notification of admission. So it's a little bit different there. These surgeries route through op time, which really just means that it's holding a bed. Whether you are going to be staying overnight or leaving the next day, the authorization changes based on that. And then, of course, performed in an OR setting, just meaning that the patient needs some type of anesthesia. And then our outpatient workflow. So for this team, they do benefits and authorizations as well as the surgery team. However, kind of going back to what Jill was saying, based on the insurance plan, they could need a PCP referral from their primary care physician in order to be able to see a specialist. So it's kind of a 2-step process then. They need that provider referral to even come and be seen, and then they might still need an authorization for the service on top of it. Our team then will submit all supporting clinical from the physician. So any office visits, any testing that would support why this procedure needs to be done. And then it routes to our follow-up team. Ideally, when they're following up, will get an approval. And if they don't, if it does happen to go into a denial, we work directly with the provider as well as the patient financial advocate team to really prove and push the payer to ultimately pay for the service.
So just the last bit of what I'm going to leave you with, I like to tell everybody when it comes to working with your insurance companies, working with us as healthcare providers, always use your brain. So I'm going to just give you an acronym. BRAIN is for benefits. So know your benefits, know what they are, know how they work for you, know what they can do for you, know what your responsibility is, know what your insurer responsibility is. And then obviously the healthcare organization as well. We have a responsibility as well in that. What kind of alternatives do you have or options do you have when it comes to whatever the care is and working with your insurance company and the health organization? And then know how you feel about it. If you're not comfortable with the information that you have, go back, ask more questions. And the end is really just for if you need help, use the resources that you have. There's a lot of resources out there. We'll connect you with resources if you're struggling to find them so that you can get the help that you need and your insurance works for you in the care so that you can get better.
Great. Thank you so much. Wonderful. All very helpful. And, insurance is about as clear as mud. So, really having your clinician advocate for you, unfortunately, that's what they spend a lot of their time doing, which is probably not the best use of their time when they could be treating patients or in the lab finding new treatments. But, unfortunately, that's the reality that we live in. And their voice will go farther. They have the resources there. So, again, reach out to your provider, to your hospital, and they will fight for you. The other thing is we have financial resources on our website, melanoma.org. There are a lot of other groups and foundations that provide financial support, especially travel support, which we know as uveal melanoma patients, you guys have to travel quite far sometimes, depending on where you live. So please visit our website as well and check out those financial resources and some of the groups that we can help direct you to get additional support to make it easier on you all. So with that, are there any questions? Yes.
I'm not sure you're able to speak to this or not, but I was wondering if you could explain a little bit about traditional Medicare versus Medicare HMOs?
So I can explain a little bit. So Medicare A and B is what we would call an 80-20 plan. So for the most, Cleveland Clinic is a Medicare provider. So for Medicare providers, there is a pre-negotiated rate. It's like a contract basically with the government. And 80% will be taken care of by Medicare, 20% will be patient responsibility. With the Medicare Advantage, Medicare replacement plans, you still technically have Medicare, but Medicare is not paying for the services any longer. It is going over to whoever that Medicare replacement plan is. So if you have AARP, United Healthcare, Medicare Advantage, United Healthcare is actually now the administrator of the plan. That's who you're working with as the insurance company. You're no longer technically working directly with Medicare. So it's really who's paying for the plan. Those do offer some different benefits that traditional Medicare does not offer. So they have extended benefits that Medicare would not offer.
Do you end up paying a little bit more for that?
You do. You have a premium that goes along with that. It depends on the plan. And they, again, in those Medicare Advantage plans, you have HMOs, PPOs, EPOs, all of the same kind of different level of plans. So it really depends on what you're looking for. Whereas with Medicare, it's a straight 80-20, you know what you're going to have. Now they do have some copays associated with that. They do have a deductible associated with Medicare. Some of the Medicare Advantage plans have that, some of them don't. So it really depends on what type of care you're looking for and what the extension of benefits are
And
that you're
monthly
looking.
premium.
Correct, and your monthly, exactly, your monthly premium.
Well, great. Thank you.